This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. My name is Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
It's a problem you can't easily hide, especially if it involves the body's largest organ. Weighing an estimated 8 pounds and covering a couple of square meters, the skin is vital for our survival. But once you are infected with a skin disease, you may suffer in a myriad of ways.
If you take it for granted, then eventually it may cover the rest of the body. Then you will be spending more because initially you will get well with only topicals.
The list of skin diseases include acne, eczema, melanoma, psoriasis, athlete's foot, jock itch, and many others. These diseases can clearly be embarrassing for a lot of people, and most just don't like to talk about it. But if not taken seriously, most situations can possibly get out of hand and may eventually require the help of a dermatologist. What are some of the most common skin diseases among Filipinos? How can you avoid having these diseases? Find out the answers tonight on MedTalk.
And joining us tonight is Dr. Daisy Ismael, the chairman of the Department of Dermatology from the University of Santo Tomas Hospital and the vice president of the Philippine Dermatological Society. Also joining us is Dr. Dina Ramiscal, head of the Photodermatology Unit of the St. Luke's Medical Center and a member of the Philippine Dermatological Society. You may join the discussion by calling our hotline at 548-4678. Good evening, doctors. Welcome to the show.
Good evening. Good evening.
Looking lovely in orange. Doctors, tonight we're going to be talking about skin diseases. But first, let's get to know the role of our skin in general well-being. Dr. Dina?
Yeah, basically, the skin is the largest organ of the body. And it acts as a protective barrier, the hostile environment. It also serves as a thermal, it insulates us from cold and also for sensation, tactile sensation especially. So there's a lot of role of the skin.
Mm-hmm. And why is it important, Dr. Daisy, to take good care of our skin?
Yeah, as you can very well see, it will not function as a protective organ if it's not functioning well. If there is a cut on the skin, then the bacteria or any infection sets in, and it will really affect the entire body. Mm-hmm. So it's really important not to also consider the cosmetic value of the skin. You have to take care of it to be presentable.
Mm-hmm. So how do we take good care of it to be presentable? And you mentioned the cosmetic value of the skin. What exactly does that mean?
The skin actually is a window to what's happening inside your body. If you have a healthy body, then your skin will definitely also reflect the health that you have. Mm-hmm. So the best way to take care of the skin is to take care of your body also. Anything that's healthy for your body is also healthy for your skin.
Good hygiene, no?
Yes, number one. That's the most first and foremost,
mm-hmm.
hygiene.
And good hygiene starts from when we're kids. And we acquire, when we're born no? We acquire that habit as we go on in life. But somewhere along the way, we encounter skin problems, and which leads us to the most common skin problems that Filipinos face. Dr. Dina?
Because we live in a tropical country, the most common, I would say that the most common skin problem we encounter in the clinics is infections. But we also see acne as well as eczema.
Okay, and this is brought about by, as you mentioned, the
Infection is hygiene, of course. Like we said, it's supposed to protect, the skin is supposed to protect us from the environment. It's a barrier. Now, any break in that barrier, that will be a potential entry for any microorganism, bacteria, virus, and fungus to enter the skin and invade the skin and thereby set the infection.
Dr. Daisy, is there a particular period within the year that you see more patients because of the change in weather, because of more infections and more bacteria that they experience in their skin?
Yeah. During summer, I suppose, when we get a lot of miliaria, the patient scratches, and then with those tiny scratch, there are openings on the skin, and then the bacterial infection sets in. So I think that's when we see a lot of, and during of bacterial infections. And we see during the rainy season, so it varies also. During the rainy season, we see a lot of fungal because they wade in floods. So they get a lot of fungal infections of the feet.
Also during colder months.
Yes, I was about to ask.
Yeah, during colder months, we also see, especially in the private clinics, we see a lot of eczema flares.
What are eczema flares? What do they look like? And
Eczema is inflammation. Basically, eczema is like a layman's term for dermatitis. Dermatitis is the medical term for that. It basically means inflammation of the skin. So, patients present with red, itchy, and scaly patches all over the body. And then, sometimes this is aggravated by dry skin. So, they usually flare during the colder months.
so eczema, is it considered a skin disease? Is it considered a chronic skin condition that keeps coming back? Or with one medication or one application of topical ointment, it's going to go away?
It depends on the kind of eczema, actually. There are acute eczemas and there are chronic eczemas. So chronic eczema, they linger. Sometimes you'll have it for life. And they keep recurring. It's like they come and then they go and then they come back again and then they go.
So this is a common Filipino skin disease, eczema, during the colder months.
Colder months, that's when they flare up because their skin becomes drier, so they flare up. But they can be present all throughout the year. It's just that sometimes during the, just in summertime, they do not flare because of the humidity. So unlike in colder months, their skin becomes very dry, so they get a flare.
So eczema, what other skin conditions are common to Filipinos, Dr. Daisy?
So in addition to the eczemas, we have different types of eczema. So we have the atopic eczema, wherein genetic is part of the cause. So it kind of lingers and it flares, and sometimes it's better during times of the year. But there are kind of eczemas that are caused by external factors like contact dermatitis or contact allergies or irritant contact dermatitis due to detergents. That is when you get rid of the cause and then treat it, it goes away. But those that are genetic kind of lingers, you just aim to control.
There's an entire, how do you call that? Their family of skin diseases, and eczema is just one of them,
Yeah.
There's so much to talk about, there's so much to learn and address when it comes to skin
Eczema,
conditions
yeah.
and eczema for that matter.
Yeah.
Is there an underlying medical condition when one is diagnosed with eczema or other skin conditions for that matter?
Not really. Maybe more for infections. But for eczemas, genes play a major role.
So if your family members have it, then the likelihood of you having it is...
Especially atopic dermatitis.
So what is atopic dermatitis?
Atopic dermatitis is it's a chronic relapsing dermatitis. It's a chronic eczema, and usually the patient herself or himself also has a personal history of either bronchial asthma or allergic rhinitis, or the patient has a family history, like his parents, his siblings have history of the same, either atopic dermatitis, bronchial asthma, or allergic rhinitis.
Wow, that's a lot to to digest.
Basically, it's allergic. It's more of because bronchial asthma is something allergic in nature,
Yes.
right? So when they get exposed to something that will trigger their attack, they get the asthma. So it's something like that. For atopic dermatitis, basically, like I mentioned, it affects the 3 organs of the body. One is the nasal passages. You have the allergic rhinitis, and then the lungs, bronchial asthma, and then the skin, which is atopic dermatitis.
So is sneezing or a sign that you already have or that you will have your
Not really,
atopic
because sometimes
dermatitis?
you sneeze because you have colds. But you know, the more when you get some patients, when they get up in the morning, when they wake up, and then they start to sneeze, and that happens every day, and they don't even have cold. So that might be allergic rhinitis.
Not to link it right away to,
Yeah.
to your eczema
Yeah.
or to your other skin conditions. We'll talk more about skin diseases when MedTalk returns.
Did you know that every month the entire outer surface of your skin is replaced? According to top10s.com, you would be experiencing nearly 1,000 new skins in your lifetime. In fact, the average person can shed enough skin cells to fill an entire 2-story house.
We're back here on MedTalk, still talking about skin diseases. Now let's talk about one more common Filipino skin condition, which is acne. Dr. Daisy, what is acne and how does this develop?
The main reason why you get acne is the plugging of the follicles. That is the basic thing. That's why they tend to prick their acne. They're trying to get rid of the plug. And there are many causes to this. One could be genetic, multifactorial actually. And there are also other factors, not just genetic, like cosmetics. Yeah, they use something that on the face that's not nice, that's not good for them. They develop outbreaks of acne. Internal diseases can also cause acne, like endocrine problems, drugs. Sometimes they took drugs, or they applied something on the face, medications on the face that can cause acne also. We do get.
So acne, does it necessarily mean that if you have one pimple, you already have acne?
Yeah.
That's acne already.
Yeah.
And my thinking is acne is like several on the face or the back or the chest.
No.
Pimple is acne also.
Pimple
What
is the
they call-
layman's term.
What they call pimple is acne also.
Okay. And once you have a pimple in your teenage years, does it follow that you won't have it when you're an adult?
No, it doesn't.
And vice versa?
It doesn't follow. It doesn't follow. Sometimes you do get them beyond. So after the teenage years, they start
They
getting
still have
acne,
it.
Which is adult acne.
which is adult acne.
I get that once in a while, and I was thinking, wow, where's this coming from? Is it an oversecretion of the oil glands, or if you're stressed, or if you eat the wrong type of foods?
Sometimes it might also be hormonal.
Okay.
So it would be sometimes when we see patients, adult patients, and they didn't have history of acne when they were younger, and then all of a sudden they just appear. We work them up for the possibility that they might have some endocrine problems or hormonal problems.
When is the best time to see your dermatologist when you have a pimple? Right away? Or should you wait and see if it dries up or it doesn't come out again? What's the best time, Dr. Daisy?
If you're gonna ask me, it should be right away.
Because if we don't, the tendency is for us to prick it.
Yeah.
Then that causes more problem. Because the acne lesions become bigger, and when they become bigger, the likelihood of scarring is there already.
Okay, and that is the dangerous part of pricking your acne, the
Yes.
scarring. That
Yeah, the
might
scarring
happen.
and inflammation and infection.
Doctors, we have a question from Twitter. How can I minimize large pores? Larger pores tend to have more acne, is that true? To develop more acne.
What they call large pores, sometimes we see people with large pores, they're kind of genetic. All of them are like that. The oily skin and then large pores. Or sometimes we see patients who had history of acne, large blackheads, and then when they heal, they're kind of poor. So those are scars, actually scars of acne. And that's very hard to treat. No matter what kind of topical you put on them,
It will stay.
it will stay.
So you cannot minimize the large pores once they've already had a blackhead which is big or a
Because sometimes
pimple?
they mistake the acne scars as pores. So they think they're just large pores, but actually they're not pores, but they are scars.
So how do we prevent these scars from happening?
Treat the acne.
It's so tempting eh.
treat the acne,
Okay.
the early stage of acne. That's how to prevent scars.
Because sometimes when we talk about a pimple, it's like inside, it's like hibernating, and you can already feel it without the pus. So do we wait for it to come out, or we treat it right away
You treat
once
it right
feel
away.
the bump?
You can go and see your dermatologist and they can treat it right away so it doesn't get worse. Because if you prick it, the more it will get inflamed. So the more problems you will have. So I think, yeah, I agree with Dr. Ismael. You should see your doctor right away.
Okay, Facebook question this time, doctors. I've never had acne as a teenager. Why am I getting acne now as an adult? Oh, we talked about this earlier.
Yeah.
Adult acne.
Because there are many causes to it. It could be hormonal, it could be something that you applied. So those are the usual reasons why they get acne as an adult.
Yeah, one more thing about something that you applied and it causes acne. There are some eczema or dermatitis, and they might have initially a dermatitis, and then they went to this is very common here. You go to a pharmacy and then they give the patients topical steroids. So they apply it, especially on their face, because it says there it's anti-inflammatory or anti-pruritic. So they think that everything that itches, some drugstores, they give topical steroids. So they start applying it. But one of the side effects of this medication is acneiform eruption, especially if they use it for long periods of time, they can get acne. So that might be the cause. It's not really something genetic or something hormonal, but side effect of the topical medication the topical steroid.
So it's always wise to get
See your doctor.
see your doctor and not do over-the-counter
Yes.
medications, or not do bathroom surgery
Yes.
when you do break those those little pimples that you see. Blackheads and whiteheads are considered as pimples also.
Yes.
Yes.
Okay. So what
They
is the
are the-
difference between
They
the
are-
whitehead, the blackhead, and the pimple?
The whiteheads and blackheads, they're the non-inflammatory lesions of acne. You know the blackheads, the black,
Yes.
they're the open comedones. And the whiteheads are the ones that are closed. They're just bumps and they're skin colored. And they are time bumps. We call them time bumps of acne.
Oh,
Because
no.
when you try to prick them, the plug gets in to the skin, ruptures into the skin rather than comes out. And that's a problem. They become inflammatory after that.
They become the red big bumps there.
So when you do it the
Cysts.
night before, the next day they're inflamed already.
Yes, but sometimes you're thinking, I can do it the night before, so tomorrow morning it's gone.
Tomorrow morning, they're more inflamed.
Tomorrow morning, you have to call your dermatologist
Yes.
already. Okay, one more question from Twitter, doctors. How often should a person wash his or her face? It's part of hygiene, no?
Yeah, maybe 2 to 3 times a day. Do not overwash. Otherwise, you destroy or you eliminate the lipid layer of the skin, which is a protective layer. So it's not healthy to be washing your face so frequently.
What
2 or
ti-
3 times a day would
Two
be
or
good.
two
Yeah.
to 3 times a day. How about in the summer? It's very hot, very oily.
Still the same.
2 to 3 times a day.
Still the same.
Okay.
Yeah.
Any type of facial wash, what ingredients should we watch out for to
Depends.
moisturize our skin or to protect it from that will serve as a barrier?
So it depends on the skin. If your skin is oily, you have to use the drying soaps. If your skin is dry, like the eczema to skin, you have to use the moisturizing soaps. So it varies
Soap-free
on the-
cleansers.
It varies on the skin.
So if your skin is oily, does that necessarily mean it's good because it delays the aging process?
Yeah, in a way, but you get more acne. You're more acne prone when you're oily, but you get less
Wrinkles.
But if your skin is dry, do you get more wrinkles and less acne?
Yes.
Okay, so just see the dermatologist now, so you can balance out the oiliness and the dryness of your skin. Doctors, how about other Filipino, more common Filipino skin diseases? We talked about eczema earlier. How about dermatitis and psoriasis?
Eczema and dermatitis, they're basically the same. Dermatitis is just the medical term for eczema.
It's a general term. Dermatitis, any inflammation of the skin, we call dermatitis.
Oh, okay.
Any skin disease, dermatitis. But psoriasis is different from eczema. It's a chronic disease, and it's dry, scaly red patches, and they predilects on the scalp,
Elbows.
and then elbows, anywhere else on the skin. They are dry, not like eczema. The patients will tell you there's fluid, it's weeping, there's fluid. That's how to differentiate. But they're both itchy, and they tend to be chronic also because psoriasis has familial also. Genetic also.
And while doing my research, I stumbled upon the words tricky to diagnose. So eczema, is it tricky to diagnose as well as psoriasis, even if they're, as you mentioned, they're different? Because they're both flaky or they're both scaly?
If you're used to looking at it, then I don't think there will be problem.
it's
But
easy.
usually eczemas, they are clinical diagnoses. You don't usually do biopsies to make it. There's no laboratory to make that. Usually when the patients come into us, they will tell you they have eczema. They've already diagnosed.
Yeah, I think that's the tricky part when you self-diagnose and you think it's this type of skin disorder, but when you actually see the experts, it's something else.
Psoriasis, they have a very specific look. When you see one, it's almost always impossible to miss it. Especially if you see a lot of cases. They're dry, big plaques. It's elevated, and then they have very thick, silvery white scales. Sometimes when they walk, they leave a trail of scales. And usually it affects the scalp and the elbows, the knees, any area of the body that's prone to trauma. That's where they usually appear.
Does this develop during childhood, or do you develop this as an adult?
It
Any
depends.
Any age.
Any age, yeah.
We see them in children, we see them in adults.
And the certain triggers or factors that can lessen the itch or lessen the scaling?
Basically, that's how they present, and you have to treat them if you want less in itch, we give antihistamines and then some topical medications. And other patients with really severe diseases, like they involve more than 10% body surface area, we usually give other forms of treatment like phototherapy, which is
your specialty.
Which is the use of ultraviolet light. And then for more severe cases, we also may give oral medications to control. There's no cure. We can only control. And lastly, we can also give biologics.
What are biologics?
Biologics are targeted treatments. They're the newest treatment for psoriasis, and it has, compared to all the other compared to the oral treatment for psoriasis, it has least side effect because it does not affect any other organ of the body. It's directed therapy. So
that's special therapy already.
yeah,
for
it
those
just
with
really
severe-
targets the skin. Yeah.
Right, Dr. Daisy and Doc Dina will talk more about skin diseases only here on MedTalk.
Did you know that every inch of your skin has an exact stretchiness and strength for its location? In fact, the skin of your knuckles is very different to the skin on your belly. One of the most common skin diseases in tropical countries like the Philippines is an or white spots.
An can manifest like small, cercinet also, bilog din yan, patches maybe on the face, on the trunk, but it may extend all over the body. You can get it from sharing towels, sharing underwears, sharing garments, sharing shirts, all of that. Or what is an aggravating factor is poor hygiene.
A person dealing with an may notice white patches on his or her skin that can appear to be scaly. Symptoms include clear indications of discolored skin, increased sweating, and an itchy feeling in the affected areas.
We're back here on MedTalk, still talking about skin diseases. You may join the discussion by calling our hotline at 548-4678. So we've talked about acne, we've talked about dermatitis, eczema, psoriasis. Now let's talk about an. What exactly is it and how does it look, Dr. Daisy?
It's tinea versicolor sa medical. And as the name implies, versicolor it's of different colors. Pwede siyang white or pwedeng brown or sometimes even red. Patches that are scaly or flat. They're flat. And they can be small, they can be big patches, usually on the trunk. And they're slightly itchy only.
Okay. How does one develop an?
The exact transmission is not known, but it can be skin to skin.
Skin to skin contact.
Yeah, it's a fungal infection, so I guess skin to skin.
Is it still very common? Because as a child, I'd hear that a lot. Now, that I'm a bit older, not so much. But is it still prevalent?
I think it's more common among patients, among people who always who perspire more and who works in a humid environment because they sweat a lot, no? They perspire and then they don't change right away or they don't take a shower 2 times a day. So the perspiration, the humidity, it serves like a perfect environment for these yeasts and fungus to grow. So I think hygiene is very important when we talk about an. Also, you mentioned when you were younger, I see a lot of cases in the clinic, in my office. The mothers bring their children to me and they fear that their children might be having an because of the white patches that they see on the face. They're not actually they mistake it for an. So sometimes it's overdiagnosed.
Okay. So what are those white patches?
Those are, we call it pityriasis alba. Those are just really nothing, just white patches on the face. And it's usually part of, remember we talked about atopic dermatitis a while ago? Pityriasis alba may be one of the skin symptoms or findings that we see in patients with atopic dermatitis. And a lot of mothers, a lot of moms, they mistake it for an. So they get very worried. They bring their children to the clinic and my daughter or my son has an. When we check, it's not really an. An usually you see it in the covered areas like the chest, the upper back, the shoulders.
Yes.
Yeah, the problem with an is they are skin color. They're almost blends very well with the skin. It's slight discoloration only. And very little itching. So they don't treat it until they're widespread. That's a problem with...
Oh, I was about to ask.
They wait for it to spread.
Spread, yeah.
And of course, like any disease, it's very difficult if it's already widespread.
So once you see a little patch,
Go and see
go
your
and see your even if you diagnose it to be something else, at least you get
Yeah.
the expert's opinion on what it really is.
Because sometimes a lot of patients, when they come and see us, they've already gone to the drugstore, and again, they are given topical steroids for an, which is not the treatment for an.
And the other problem with an is even after correct treatment, the pigmentation stays. It doesn't go away anymore. If it's with you for a long time,
You still see, you're cured of the an, but you still see the white patches there. So they think that I still have an, but actually they're cured. It's just like a scar. It's a post-inflammatory pigmentary change, but they're already treated.
Okay, so is fungal? Is it a fungal infection? So
yes.
the fungus has died, but
But the scar,
the mark,
it's something,
the scar.
it's a mark, yeah. It's we call it post-inflammatory pigmentary change.
How about for athlete's foot? We were talking about fungal infections, and we were talking about when you sweat and you're not able to change right away.
Or shower.
Or shower right away.
Yeah.
About athlete's foot, a lot of people are getting to or being very fit. That's a thing that a lot of people are getting into now, exercising and trying to be healthy. But at the same time, there's that risk of getting athlete's foot if they don't
Yeah,
take a bath right away.
Athlete's foot, it's not just confined to athletes, no? Anybody can have it.
Why was it called athlete's foot in
Probably
because
athletes,
they're more common. The predisposing factors are there in athletes. You wear shoes for a long time, and then there's maceration, there's moisture, there is perspiration. Those are the predisposing factors.
But anybody can have it. If you wear closed shoes for long periods of time, and then you don't really wash after, so the toes, diba? The maceration. So that the maceration and the occlusion.
What's maceration and occlusion?
Occlusion is you occlude. There's no air, okay. And then the sweat. Again, that's a perfect environment for the fungus to grow. It's like you feed the fungus. So that's where they grow, and then the toes are close to each other. So you see maceration, whitish skin in between the toes.
So that is the
Athlete's foot. Yeah, but there are two kinds actually. When we talk about athlete's foot is tinea pedis. When we talk about tinea pedis, there are two kinds, the dry type and the wet type. The maceration that we were talking about, that's the wet type. It's very itchy, and it's also foul smelling.
That's contagious. Is it contagious?
Not very, because it depends, like I said, depends on your hygiene.
Okay, so the wet is, you see it right away and it has a foul smell. How about the dry?
The dry, you see scaling. Scaling, moccasin type.
We see them with people who are very busy. They take a bath in the morning, and then the feet are not yet very dry. You wear the shoes at once,
socks, yeah.
and then you're wearing the shoes the entire day. The fungus likes that.
So it's like a perfect party place for fungus to stay in there the whole day. Does it? How about jock itch? Since we're talking about working out and hygiene as well, jock itch, is it the same?
Yeah, it's the same. Maceration. If you'll notice, they like areas that are occluded. So it has to be aerated. The area has to be aerated.
How about treatment for athlete's foot and jock itch? Is it oral, topical, or combination of both, and good hygiene, of course?
Foremost is hygiene.
Okay.
For mild infections, topical medications would control the disease or would cure the problem, would solve the problem. But for widespread infection and for more severe infections, oral medication is warranted.
But of course, we don't want it to get to the severe infection.
Yeah, but some patients, they come to you when their condition is already very severe.
So how do we treat that? How do we treat those severe conditions when it comes to jock itch and athlete's foot?
Now we have oral and very good oral antifungals.
Good antifungals that will kill the bacteria and it doesn't come back anymore?
Kill the fungus.
The fungus, rather.
Yeah.
It doesn't come
If
back
it's
anymore.
adequately treated. It has to be adequately treated.
So any skin disease or any skin condition adequately treated
Yes.
won't come back anymore?
Yes. The
And
problem is
hygiene.
And hygiene, okay.
keep the area dry. And most of the patients, when they are asymptomatic already, there's no itching, they stop medication without the doctor's advice, and that's why the lesions come back.
They're just partially treated. You don't really kill the fungus. They're just sleeping there and they can wake up anytime.
Oh, no.
So our goal is to completely kill them. And not just to put them to sleep.
Okay, again, never self-medicate and never
Yes.
end your medication on your own.
Yes.
Doctors, we can't let this topic go by without talking about skin cancer because it's also one of the, would you say it's a common skin condition here in the Philippines?
It's not really very common in the Philippines because we have enough protection. It's more common among Caucasians. But we do see a few cases of skin cancer, usually in the elderly population.
Because our skin makes vitamin D once the sun shines on it, but too much much sun can lead to skin cancer.
That's
and
true.
Does that develop as we expose ourselves to the sun, or it's just a one-time thing that you've exposed yourself to the sun X number of hours and then that
Now
happens?
it's usually chronic exposure or long exposure to sun.
So long exposure to the sun can lead to skin cancer, even if you put tons of sunblock and
Yeah, it's a cumulative effect of chronic sun exposure, which means chronic UV, ultraviolet irradiation.
the best time to go out and enjoy vitamin D, doctors?
7 to 9.
And in the
morning,
afternoon?
3 to 5.
So 7 to 9 and 3 to 5. Doctors, we'll talk more about tonight's topic, skin diseases, when MedTalk returns. We are back here on MedTalk, still talking about skin diseases. Before the gap, doctors, we were talking about
Skin cancer.
skin cancer, and we were talking about getting the right amount of vitamin D, which is 7 to 9 in the morning and 3 to 5 in the afternoon. How about getting the right amount of sunblock? Does it mean that the higher the sunblock, the more protected we are?
For everyday use, SPF 30 is all right. That's all right. If you go outdoors and you expect more exposure, higher SPF would be better, like SPF 50 and higher. But more than that, what's more important is the amount of the sunblock that you apply and the frequency of application. Like if you go outdoors and you go swimming, you have to, it is highly recommended that you reapply the sunscreen every 2 hours. And then for the right amount that you apply every day, even SPF, like I said, SPF 30 is okay, as long as you apply the right amount. And what is the right amount? The right amount is about half a teaspoon for the entire face.
Okay. And when you, during summer, how much should we put on our body and how frequent?
If you go outdoors, then you have to apply more frequently. If you go swimming, you go biking, maybe you play golf every 2 hours.
So you have to stop whatever you're doing after 2 hours.
Bring it with you.
And then just
there are, sunblock comes in spray, so it's easier to reapply.
Okay. Doctors, we have a question from Facebook. If I am pregnant, are there ingredients that I should avoid in my skincare routine?
I would say beta hydroxy acids like salicylic acid. You should avoid this in pregnancy.
Why? What does that do to a pregnant woman's skin or well-being, doctor?
If you only apply a small amount, I think that's okay. But the thing is, when you're pregnant, it's better not to apply anything at all. Salicylic acid can be absorbed by the body if you apply it in large amounts, and that can cause salicylism.
When one is pregnant, there are hormonal changes as well, and one develops acne when one is
Yeah.
pregnant. What type of medication should one use if she's pregnant? Dr. Daisy.
Yeah, they perhaps retinoic. You should avoid retinoics. But for if you're just applying a small amount, I don't think it will affect. It's usually the oral medications that we prohibit the usage when they're pregnant.
Okay, thank you, Doctor. We have a question from our viewer. What's the best way to treat sunspots? What are sunspots? How do we determine that we indeed have sunspots?
Sunspots, the freckles,
I guess.
or the age spots,
Because
or the age
it can
spots.
be-
They're both sun-related. They're pigmentations on the face
Okay.
because of chronic sun exposure. The best again is avoidance. The use of sunblock, physical protection, avoidance of the sun if you don't want age sunspots to come out.
So freckles, we know that those are the brown pigmentations of our skin. How about the other sunspot that you mentioned?
Age, we call it age
spots,
spots.
yes.
Yeah,
How
you
does that
also,
look?
They look like freckles, but they're usually darker and usually bigger.
Oh, they're map-like. Not really.
Circular, they're
Yeah,
round.
the ones that you see in the elderly that are
Yeah, they're-
facial warts, in elderly, they start out as flat macules, as flat lesions.
Okay.
So we call them age spots.
Age spots. And this is brought about by sun exposure.
chronic.
Sun
Aging,
exposure.
Oh, okay.
aging,
All right.
chronic sun exposure. And for age spots, we have a handful of treatment options for that. But I think for me the best would be laser.
Laser.
Yeah.
Laser surgery? Is that
Laser-
Laser, like what you mentioned earlier, the photo.
No, it's it's laser,
Ah,
pigment
okay.
laser. We use
Okay.
pigment lasers for those.
So it evens out the skin.
Now it would take out those spots, those brown spots.
And when the brown spots are removed, they don't come back?
Sun.
And when you expose yourself to the sun, again, it comes back.
Yeah.
But doesn't that make your skin thinner
Which one?
when one is goes through the laser?
No naman. It just takes out what it's supposed to take out.
Okay, it
So
doesn't
it's
make the skin
no,
thinner and more sensitive.
No, it will just remove what is supposed to be removed.
Okay. All right, doctors, what steps should one take in order to keep our skin healthy, keep our skin blemish-free, so to speak, and to avoid all these itchies or the spots that we
Yeah, as
do
was
not want to see?
mentioned, good hygiene, sunblocks, avoidance of the sun, and if there are first early signs of skin lesions, you have to have it treated already.
So the first sign of something that doesn't look right
Yes,
Yeah.
that's right.
in your body.
Yeah.
You have to go and see your doctor.
Okay. And during the colder months, you mentioned
A lot. Apply a lot. Apply a lot of moisturizers.
moisturizers, depending also on your skin type.
Yeah. But basically, moisturizers are the same. They moisturize the skin. So there's no moisturizer for oily skin. It's
Okay.
just one moisturizer.
Is it like sunblock that you have to apply every 2 hours or every so often, the moisturizer?
For extremely dry skin, they may be applied more often.
Like now, a lot of people are traveling to colder countries, and
Yeah.
when they come back to the
Yeah.
Philippines, they have a lot of itchies and
That's
rashes.
true. Yeah, because they don't. Yeah.
Dry skin can cause itching. That's correct.
I've experienced that, and it really is itchy, and
Yeah.
you have to just keep on applying
The
your
moisturizer. That's true.
How about foods that we should eat more of, or foods that we should avoid? Dr. Dina?
Basically, any food that is good for the body, for the general health, would be also good for the skin. Drink a lot of water and eat more vegetables, high fiber diet, fruits. I think this should be good for what's good for the body in general should be good for the skin.
And it's also good to visit our dermatologist. How often should one visit our dermatologist?
It depends on the skin problem. It depends on the skin problem.
If there's no problem, doctor, and just for maintenance.
The dermatologist will tell you how often.
And can you tell us, you mentioned Dr. Daisy will tell us how often, the dermatologist will tell you how often you should visit. So doctors, maybe you can, for your final words, what advice would you give our viewers in taking good care of their skin?
Yeah, I think you have to choose your dermatologist. Not all who claim to be skin specialists are really trained in dermatology. So my advice would be to make sure they're really trained, and preferably somebody who's a member of the Philippine Dermatological Society.
Okay, thank you very much, Dr. Daisy. Dr. Dina?
She already said it. Yeah, my last words are probably when you have any skin problem that you notice, please don't go to the pharmacy right away or to the drugstore and ask for medicine from the pharmacist. Go and see your dermatologist. There's a lot of us, I think it's also, they can go online, right, doctor? They can go online and they can check for the list of fellows and diplomates of the Philippine Dermatological Society that's close by or near their area.
Okay, so thank you once again, Dr. Dina. Thank you, Dr. Daisy. Dr. Daisy Ismael and Dr. Dina Ramsical for enlightening us about skin diseases, how to take good care of our skin, and to see our dermatologist right away once we see something that isn't really supposed to be there, so to speak. See you again next Tuesday, 7 p.m. here on MedTalk, your scheduled on-air consultation on the Solar News Channel. This is Angel Jacob. Good night.